Hello, my name is Dr. Alan Francis. I'm Professor Emeritus of Psychiatry at the Duke University School of Medicine, was former chair of its department, former chair of the DSM-IV task force, and also the author of the book Saving Normal. Today we're going to be discussing diagnostic inflation in psychiatry, its causes, its consequences, and its possible cures. There's no one cause, and the many causes interact with each other. The beginning of the problem is that the diagnostic criteria are far too loose. There are too many diagnoses, and the defining features of each diagnosis are so easy to make that many people who are basically normal are misdiagnosed as having mental illness. This gets made worse by the fact that in everyday practice, psychiatric diagnosis is often not done carefully. And if anything in the DSM manual can be misused, especially if there's a financial gain for the misuse, or if there's insufficient time to do an adequate evaluation, it will be misused, mistakes will be made. And in actual practice, about 80% of psychiatric medicine is given by primary care doctors, not by psychiatrists. And often they have little training in the use of the manual and only about 10 minutes to do the evaluation. So they don't really get to know the criteria very well, and they don't get to know the patients very well. And this most often leads to overdiagnosis. The whole system is pushed by the gorilla in the room. The drug companies spend hundreds of millions of dollars every year trying to convince people that medication's needed in situations that would be better left alone. And they've been able to convince the public that there's a pill for every problem, that all emotional problems have their source in a chemical imbalance, and that to correct the chemical imbalance, you have to take a chemical. So many people who would get better on their own, who wouldn't need a diagnosis, are treated unnecessarily because of drug company marketing, misleading marketing, both to the public and to the physicians. The third driver of overdiagnosis is the need, especially in the United States, to make a diagnosis on the first visit. Insurance companies won't reimburse physicians unless they have a coded diagnosis. And very often in psychiatry, it's impossible to make a diagnosis on a first visit. It may take many visits before the diagnosis is clear, and there's a tendency to overdiagnose in situations where there's still a great deal of uncertainty. I always say that all psychiatric diagnosis should be written in pencil. It's much better to underdiagnose than to overdiagnose. It's very easy to increase the severity of a psychiatric diagnosis. It's very difficult to erase a diagnosis, and it will often haunt the person for life. Finally, patients have been conditioned to ask doctors for medication, and this leads to a 20 times increase in the tendency of physicians to prescribe a particular medication. The dogma that many of the problems of life, the everyday aches and pains of everyday life, can be solved with medication has become widely accepted by the public, and patients are often very impatient and importunate that physicians give them medication. What's the result of all this? In the United States, 12% of the population is on an antidepressant. Amongst women over 40, 25%. The anti-anxiety agents are wildly overused. 8% of the elderly are taking a benzodiazepine, 4% of the general population. Amongst children, about 20% of boys are diagnosed as having attention deficit disorder, about 10% of girls. And about half of these get medication. And we know that this is overdone because many studies done in several different countries with millions of kids have shown that the best predictor of attention deficit disorder is your birthday. The youngest kid in the class is twice as likely to get the diagnosis as the oldest kid, proving that we're making immaturity a mental disease and treating it with medication, which is absolutely ridiculous. The elderly and children are the most likely to be overdiagnosed. In kids, developmental lags, school stress, parental problems, family difficulties, all get translated into a psychiatric diagnosis and very often treated with medication. In the elderly, very often it's taking too many medicines with side effects that are psychiatric. And the first thing to think about with any elderly person you see is this due to a medication? Is this due to a medical illness? I think that the cures for these problems are easy to conceptualize and hard to effect. It's clear that the diagnostic system should be tightened, that certain diagnoses should be eliminated altogether, that there should be black boxes, warning boxes for those diagnoses, particularly things like attention deficit disorder and major depression and generalized anxiety that are wildly overdiagnosed in the population. There should be an indication in the manual itself of how these things are overused and how to correct that diagnostic inflation. I think it's very important that drug companies not be allowed to market to the public and not be allowed to market to physicians. If drugs are worthwhile, they will sell themselves. We should not allow the drug companies to be misleading us. It's very important that evaluations have enough time so that the doctor gets to know the patient and should be spread out over many, many different sessions so that people have a chance to get better on their own with watchful waiting. There'll be much reduced overdiagnosis if the doctor's not forced to diagnose in order to be paid on the first visit. And finally, I think we have to educate everyone, the public and physicians, that there certainly is not a pill for every problem, that there's not an easy solution to life's difficulties and disappointments and losses and stresses and griefs, and that very often the treatment will be worse than the disease. The most important thing that everyone consider is first do no harm. And at this point, people who really need medicine often don't have access to it, that they're neglected, while people who would do a lot better without medicine are receiving far too much. I hope this has been helpful. Remember, psychiatric diagnosis should always be written in pencil.